I'm back to doing the videos for week 6. As you can see, I have a little bit of bruising like on my face here, a little bit around my lips. So my horse and I just basically collided. I was putting fly spray on him and he turned his head around to knock off a fly, and we both just basically like smacked each other right in the face. He's fine, nothing wrong with him, but it's a little bit better today. Okay, so it is week 6. I just a few minutes ago uploaded your next case study. Now her name, let me turn my phone off real quick. Her name is Veronica. Now this case study focuses on PTSD, and as you guys know, this is an area where if anybody's heard of mental disorders, PTSD is one of them. Most people know that we're having an issue with PTSD in our society today, in our culture. I have made a PTSD video, so if you can check out that video even before you start the case study. Go through and read. I know your chapter has a little excerpt on PTSD, but I made a video and it just discusses a little about some of the changes that were made with PTSD. The symptomology with PTSD is a lot of symptomology, and one of the reasons that I gave Veronica, I was trying to find this case study, is it just happens to match the new criteria in the DSM-5 for PTSD. So I was looking for a case study that would give students an example of the new criteria, and that criteria is the unexpected loss of someone very close. Now, standard for PTSD as far as criteria, you either have to, witness a traumatic event, you're watching it, and you're looking at the person's life at risk, you as well going through the traumatic event. But then they added from the DSM-4 to the DSM-5 this unexpected loss of someone very, very close. And so when I was looking for the case studies, I found Veronica. So there's 4 clinical questions to Veronica. Think about it. Think about going through and doing what I had mentioned when I gave you guys feedback on Margaret. First of all, fantastic job on Margaret. But look biological. What is going on biological? That could be reinforcing, causing some of the other symptomology to increase, to exacerbate in those symptomologies. Psychological, and then look at cultural. So again, keep that framework in mind. Kind of go through, maybe read it, and then go through and look for biological, psychological, and social cultural when you're answering those questions. Kind of really think about it. I mentioned in the video two words that you'll see in PTSD, and then we'll talk about it again in dissociative. That's derealization and depersonalization. And again, I explained the derealization, the depersonalization. So that's going to be important as well. So start on Veronica. Try to go ahead and get this one done, and I'll give you feedback on Veronica. I have decided not to upload Tommy. I know it mentioned Tommy in your syllabus. That is separation anxiety, but I just really want to focus more to the anxiety disorders. Separation anxiety actually falls under childhood disorder. So I decided to hold off on that. So I'm just giving you the one, just on Veronica. Work on that, try to get that in. And I will give you feedback to Veronica just like I did with Margaret. And I want to say, guys, fantastic job on Margaret. Just a fantastic job. I was really excited at how you really, pulled in the biological, the psychological, and the cultural to kind of get a really good clinical picture. And again, that assessment is very, very important. And just like I said, at the end of the interview and a constant assessment, what level of care does that patient or client need? So just keep that in mind and move on with Veronica. All right, have a good week. Hopefully my bruising will be gone completely by next week, and I look forward to reading your responses to our next case study. Bye.